So, when coronavirus hit, patients still needed access to basic health services like primary care and mental health visits, but COVID made it harder for patients to get the care that they needed. On top of the usual struggles like taking off time for work, people now had to keep themselves safe from infection. Services that were already difficult to manage, even in the best of times, became much harder to get. Take hearing loss, which affects 48 million Americans. On average, it takes 7 years for patients to seek treatment for hearing issues, even when we are not in a global pandemic. And COVID-19 only added to additional burdens. So that's a key reason why the Centers for Medicare and Medicaid Services made it easier for providers like audiologists to offer hearing services remotely during the pandemic. Ms. Farb, what steps has CMS taken during the pandemic to make it easier for patients to access care from audiologists through telehealth during this pandemic?
Well, Senator, as you pointed out, CMS initially expanded the types of providers that could furnish telehealth services to include all those eligible to bill, which included physical therapists and speech language pathologists, as well as audiologists. At the beginning, they were able to bill for certain codes starting in March of 2020, and some of those codes are not typically the codes that are billed by audiologists, but CMS added additional codes to the list at the end of March of 2021, and that coverage was effective retroactively back to January of 2021. The list included services such as tone decay tests and assessments of tinnitus. And so that expanded sort of the ability for audiologists to provide those services. We spoke with ASHA, the association that covers speech language pathologists as well as audiologists, and they were very supportive of those changes.
Right. So, Ms. Farb, if I can just summarize, CMS considered audiologists to be important enough to include in the response to the pandemic. But audiologists usually aren't treated equally in the Medicare program. Despite their years of schooling and training, audiologists are considered, quote, suppliers, not, quote, practitioners in the program. And outdated Medicare rules require patients to get their doctor's permission to see an audiologist rather than letting patients make the decisions they need to improve their hearing. So let me ask, Dr. DeChéry, why is it so important that seniors with hearing loss can access the providers they need, including audiologists, without bureaucratic limitations that make it harder for them to get care?
Thank you for that question. Yes, I mean, being able to hear is so important, especially for our elderly patients. I mean, there have been numerous studies that have shown reduced risk of falls, improved mood, improved memory, all by being able to hear better. I mean, we see this every day on, home visits now when we're trying to do something by video. If they can't hear, just turning up the volume doesn't work. So these patients really do need their hearing assessed and then potentially a hearing aid or whatever is needed.
Right. In other words, audiologists provide critical services to people with hearing loss. That's why I'm joining Senator Paul and Senator Grassley in reintroducing the Medicare Audiologist Access and Services Act. This is a bill that would expand seniors' access to hearing services by reclassifying audiologists as practitioners in the Medicare program, and that will allow them to bill for services without a physician referral and to provide patients with both the kind of diagnostic and treatment services that are within an audiologist's scope of practice. It seems to me that the COVID-19 pandemic has forced us all to reconsider bureaucratic limitations to healthcare, including hearing care. So I believe that the Senate should prioritize the passage of our bill to help seniors get the care that they need. Thank you, Mr. Chairman.